consultant urologist and andrologist at Mercy Hospital. He is currently the council member of Urological Society of India from East Zone. He is also a member of Endourological Society subspecialty of USI. Coming to the rules, audience are requested to mute themselves in audio and video. Each speaker will be given 5 minutes for presentation and 1 minute for discussion. Judges will be asking questions. Audience can put their questions in the chat box. Warning bell will be rung at 4 minutes and 30 seconds. Final bell will be rung at 5 minutes and the PPT goes off. May I now request Dr. Shobhik Chandra to start his presentations.
Am I visible, sir?
Yeah.
Yes, you are visible. You may start, please.
Yes, Satvir.
A very good evening to all of you, especially the esteemed chairpersons and our delegates who have worked very hard for their presentation. I know for a lot of people, it is the first time when they are presenting, and there were a lot of glitches while they were doing that, and I hope we made them comfortable, and I hope they will present it in a very well manner. And so let's start with the presentation.
Satvir, can you just introduce our judges first?
Yes, I'll do that.
Yes, please introduce our judges.
So welcome to the postgraduate poster session of 6th November. And we welcome our esteemed chairpersons. To join is first chairperson and judge is Dr. S.S. Chauhan. He is a professor of surgery at Tata Main Hospital, and his qualifications are MBBS, MS, DNB, and GI surgery from AIMS. He has been worked in the pioneer institutes like Army Hospital as an assistant professor in Delhi, a command hospital as associate professor in Chandi Mandir, in AFMC Pune as an associate professor. In AFMC Pune, he was promoted to professor, and in Army Medical College, he joined as a professor of surgery, and following it, he is professor of surgery at Tata Manipal Medical College. I welcome, sir. So our next judge is Dr. Nalini Kant Chaudhary. Sir is a consultant surgeon at Bokaro Surgical Clinic, Bokaro. Sir has done MBBS and MS, and he has served in the health Dost government of Bihar from 1978 to 2000. During his period, he also served as an RSO and a registrar in the Department of Surgery in JLN MCH Bhagalpur. Sir has 7 publications, and he was the organizing chairman of Jasicon 2015 and chairman of ASI Jharkhand chapter 2018. We welcome Dr. Nalini Kant Chaudhary. Our next esteemed judge is Dr. Vinay Pratap. Sir is a professor in the Department of General Surgery at RIMS Ranchi. Sir has an MBBS, MS, FMAS, FICS, and FIGES. Sir is a graduate and postgraduate from DMCH Lakhisarai, and sir is an examiner to various MBBS, MS in the various university. Sir started laparoscopic surgery in RIMS way back in 2001, and sir has enormous publications in national and international journals. We welcome Dr. Vinay Pratap, sir. Our next judge is Dr. K.K. Singh. Sir has an MBBS and MS, and sir is working as an associate professor in surgery in Midni Ray Medical College, Palamu, Jharkhand. I welcome all the judges and the chairpersons. So our first present, and we have a general instructions to all of them. These are the instructions. Each speaker will be given 5 minutes of presentation and 1 minute of discussion. Judges will ask questions, and if any audience have any questions, they can put in the chat box. A warning bell at 4 minutes 30 seconds will be played, and a final bell at 5 minutes where the PPT of the presenter goes off. So to start with, our first presenter is Dr. Avinash Kumar, and he will be presenting on sacrococcygeal teratoma. I want Dr. Avinash to share his screen. Dr. Avinash Kumar, please share your screen. Please unmute yourself.
Can I present?
Yes, please share your screen.
Good evening, sir. I'm Good evening, sir. I'm Dr. Avinash Kumar Sinha, a general surgeon from the Bokaro General Hospital, Jharkhand, and I'm going to present a very interesting case of sacrococcygeal teratoma. So, as we know, the teratoma is a tumor of a retention of the pluripotent stem cell, and among the non-CNS teratoma, the sacrococcygeal teratoma is the most common. The incidence is about 1 in 40,000 live birth and is the commonest congenital tumor in neonate and is most common in the female. Majority are benign and the risk of recurrence or the malignant transformation is low. The object the objective of this presentation is that as it is a very uncommon tumor, so knowing the knowledge about the tumor, its prognosis and its multidisciplinary approach of treatment in two-tier city like Bokaro, and also to predict its the outcome is an important factor. So that that's the reason why presenting this case in this conference. So in our case, a 10-day premature female child delivered by the cesarean section presented in surgical OPD with a large mass in the sacral region of size about 13 to 13 centimeter with an ulceration on its posterior aspect. Patient was admitted. Her investigation was done, which were normal, and the X-ray revealed a large projecting mass from the lower pole of the lower pole region, and it also showed the extent of the tumor. In our case, this sacrococcygeal teratoma was Altman type 2. The PAC was done and the tumor was excised with the removal of the coccyx. The post-operative period was uneventful and the patient was followed up for the 1 year, and her development milestone was very well. In this diagram, sir, I am showing the uh, case in which the large tumor is present with ulceration on its posterior aspect. This is the X-ray which shows the tumor extent beyond the coccyx region with some extension into the in front of the coccyx region, stating it's the Altman type 2. And this one is the sir post-operative diagram of picture of the image of the case. So, sir, sacrococcygeal teratoma is a